Hello and welcome to our final seed to success. Today we're going to be talking everything to do with breathing. So I don't think anyone will argue that breathing is the most important thing we do. It's the first thing we do when we're born, and it's obviously the last thing we do before we die. Breathing influences every function in the body. But before we get started, I want you to download the breath assessment, and I just want you to take a moment to see where you're at now before we learn to make changes. So the first thing we need to do is count how many breaths you're taking per minute. So try as hard as you can just to breathe normally. As soon as you're aware of it, we do tend to slow our breathing down, but try to just count your breaths as normal as you can, or you might get someone to help you out with that. So they might just put their hand on your chest or something, and you can just try to breathe normally, and they can count your breaths and have a look at the stopwatch to get a better, more accurate result there. Think about too during this assessment if you're breathing through your mouth or through your nose. And where is the movement occurring? Is it lifting your shoulders when you breathe? Are you noticing your chest coming up and down when you breathe? Is it your ribs that are expanding or your belly that's going in and out? So just try to take a moment to notice where that breath is occurring and whether or not you can actually hear yourself breathing. Think about what your posture is like. So are you sitting in a beautiful upright posture, or are you slouching for most of the day? And lastly, if you have trouble breathing through your nose, try to breathe through your nose and count how many seconds you can before you need to open your mouth to take another breath. So stop the video and go and download that, and do that now before we get started on the learning. Welcome back. So I hope you've done your breathing assessment, so you've got a little bit of a baseline and we know where we need to make our changes. So abnormal breathing is so very common. We don't realize that we're doing it, but many of us, I want to say most of us, actually are over breathing. So anything greater than 14 breaths per minute, even 12 breaths per minute, is considered over breathing. Now, here are some of the symptoms of a poor breathing pattern or overbreathing. So it's a long list of things that can be affected by our breathing. And of course, the last one on the list, certainly shouldn't be in last place, is headache and migraine attack. So have a look at the list and see if any of that could be you. So before we teach you how to correct your breathing, it's really important to know, well, why do I need to slow my breathing down? I'm doing just fine breathing away naturally without even thinking about it. When you breathe over breathing, you're getting more oxygen intake. You might think, great, that's wonderful, more oxygen, the better. But what happens is you're breathing in more and you're breathing out more carbon dioxide. So your airways dehydrate and your blood gas ratio changes. So this isn't necessarily a good thing. We do need a little bit of carbon dioxide, and it's all about the ratio of oxygen to carbon dioxide. So people don't realize that carbon dioxide is actually a relaxant. It helps the airways to open. And the big thing that it does is help oxygen be released from the blood so that can be absorbed into the cells. So there's no point taking in heaps and heaps of oxygen and having really high blood oxygen if that oxygen can't get out of the blood and into the cells where it's needed to do all of our work. So just remember, breathing too much means more oxygen comes in, more oxygen in the blood, but we're not getting that oxygen into the cells because we've blown off all of our carbon dioxide, and we need the carbon dioxide to release the oxygen from the blood so that it can be absorbed in the cells. So it's really important to get that balance of oxygen and carbon dioxide just right. They did a study that showed people after they were blowing up a balloon, for just 1 minute, there was a 40% reduction in oxygen in the brain. This is why you get dizzy when you feel like you're blowing up a balloon, feel like you might even be going to pass out. So obviously we're not all going around all day, every day, breathing at the level that you would if you were blowing up a balloon, but 40% reduction in oxygen. Even if we were only breathing and getting 5% reduction in oxygen in the brain, that would be really, really significant. With your breathing, you have a set point in your brain. So if you've been over breathing for a long time, you have this long list of symptoms, your body's breathing set point has changed. And now the automatic is just at that new level. So it might be 15 breaths a minute, 20 breaths a minute, whatever, wherever you are at with your assessment. And that's just happening minute in, minute out, hour in, hour out, day in, day out, over and over again. So what we need to do is reset that set point to where it should be. So that's just a reminder about the carbon dioxide. So why do we get these poor breathing patterns? There's lots of reasons. Trauma, stress, illness, infection, environmental factors, pollution, not enough exercise, too much exercise, too hot, too cold, eating the wrong diet, eating too much, poor posture, medication, lots and lots of different reasons. So it's not really, there's no point focusing on why am I here, what's caused this. Let's just focus on, well, we are here now, what can we do about it? So this is what normal breathing should look like. So normal is 8 to 12 breaths per minute. It should be silent and gentle, smooth and even. So we shouldn't be able to hear each other breathing. And really, we should even hardly be able to see each other breathing. So there shouldn't be big movement through the shoulders or through the chest. We should always be breathing through your nose. And we'll talk a little bit more about that in a moment, even when we're exercising. And I'm sure most of us aren't breathing through our nose when we're exercising, probably not even during the day. Our breath should be a diaphragmatic breath. So we should feel a small movement at our solar plexus, and we should feel our rib cage just ever so slightly, just expanding out laterally, very gently in and out, not up and down. It should be a lateral movement at the base of our ribs. So this is the most important slide. This is what we need to work on. How do we retrain our breathing? So I'm going to go through these points, and you can stop the slideshow if you need to and just practice as we go. So the first thing I want you to do is just to sit down in a nice posture and spend a couple of minutes focusing on your breath. If you can try to do this even every hour, while we're retraining that set point, that'll really, the more you can do it, just little and often. So just focusing on your breath. You can't change what you don't focus on. If you do find yourself throughout the day yawning and sighing, particularly if you're not really feeling tired, there's a good little exercise you can do. So when you take a big yawn or sigh, you're obviously blowing off a lot of carbon dioxide. So like we spoke before, we really need to keep that carbon dioxide oxygen ratio right, and we don't want to be breathing off this carbon dioxide. If we've been over breathing for a long time, our body starts to not like the feeling of having too much carbon dioxide because it's used to getting rid of it. So as we start to change our breathing pattern and we're starting to just build up those carbon dioxide levels back to normal, the body is going to fight it. And this is how it will fight it. It'll fight it through yawning and sighing. So what we need to do is, after you've catch yourself, obviously try to avoid it if you can, but after you catch yourself doing a sigh or a yawn, just pause your breath for a count of 3. So you've sighed out. Before you breathe in again, just count 1, 2, 3, and then take a normal breath. So after you've done that little exercise, we don't want to gasp our breath back in, because otherwise we're just going to end up with too much oxygen and the ratio will still be wrong. It'll just be up higher. So literally every time you catch yourself either doing a big deep breath, a big yawn or a sigh, just do this short breath hold of count of 3 and then just resume your normal breathing. Once your body builds up a tolerance to carbon dioxide, the yawning and the sighing will go away. The number one thing we need to do is slow down our breathing rate. So remember, we're trying to get to 8 to 12 breaths per minute. So if you can every hour, just for a couple of minutes, just try to breathe at this really slow, even slower than that, even 6 breaths per minute, just to reset that breath rate and try to get the brain to get a new set point. We always should be breathing through our nose as best as we can. Obviously, if you've got sinuses and you're all blocked up, it's not going to be so easy. But even so, try to breathe through your nose for as long as you can. The other thing to consider is that a lot of us are gasping too much air in. So what we're trying to do here is decrease the volume of our breath. So not only should we be breathing less, we should be breathing smaller. So when we're taking breaths, we don't want to be like big, deep breaths. And the exercise I teach for this is called shrinking the cloud. So imagine you've got a big cloud and you're breathing in that whole volume of the cloud and breathing out that volume every time. What I want you to think about is shrinking that cloud. So imagine that the cloud's only this big now, and that's all the air you've got to breathe in and breathe out. So this is how, especially if you're a noisy breather, you're often breathing not only too many breaths, but your breath is too big. So really thinking about shrinking that volume of air that you're taking in and out. And that's going to help with point number 6, which is your breathing should be silent and invisible. So if we're breathing through our nose, we're breathing a smaller amount and we're breathing less, then that silent and invisible will just happen by default. So as I said during the assessment, we want to be aware of where our breath is coming and going. So obviously we need to breathe in through our nose, and then we want to get the air right down into the base of our lungs. So we definitely don't want to be breathing shallow breaths up here in our shoulders. We want to feel our ribs. So it's a good exercise to get your hands and place them on the side of your rib cage. And as you breathe in and breathe out, you should feel this tiny little expansion of the rib cage in that lateral or outward direction, just around the base of the ribs. The shoulders should not be going up and down at all. So really being aware, it might even mean that you need to stand in front of a mirror and watch your shoulders. They should be staying nice and still. And this is a big problem I see with my clients that come in with migraine, headache, and neck pain, is often they're really overactive through all these accessory breathing muscles, all through their neck and up the back of their neck here as well into their jaw, because they've been using these muscles to breathe. It's also very common with people with asthma, and there is a lot of people that have both asthma and migraine. Posture is super important. It's important for everything, but it's really important for breathing. If you're slouching, it's impossible to breathe correctly. So we really need to lift our chest bone and give our diaphragm room to move. In a healthy breather, there's actually a natural pause between the breath out and the breath in. So try to be aware and see if you're doing that. So as you breathe out, you shouldn't be breathing straight back in right away. You breathe out, tiny little pause, and that's so that we can bring our carbon dioxide up to the level that it should be, and then we breathe in. So if you're not naturally doing that little pause, try to bring that in when you're doing your awareness exercise every 30 minutes or every hour. So there's a lot on this slide, but just start at the top, work your way down, and just trying to be aware. The biggest thing is just to spend time really regularly and be aware of your breathing. Some other things that will help. Indoor plants are fabulous. They will reduce the toxins in the air and give you a nice filtered air to be breathing in. Getting outdoors into nature and opening the windows and letting the fresh air in. So obviously that fresh air, getting out into nature, especially if you've got, the bush or forest or trees or a garden where obviously the plants are photosynthesizing and making the oxygen for us. So being able to breathe that in is fabulous. Staying away from toxins. So toxins in the house, like your cleaning products. I've put down here some natural alternatives that will definitely help with your breathing pattern. The other thing to consider, and we've spoken about food already, is that some foods can lead to overbreathing. And they're those high carbohydrate diets, dairy, caffeine, alcohol, sugar. So again, they're the kind of foods that we have already covered, and we've already decided that we're going to try to steer clear of those foods for our migraines anyway. So it's definitely going to help our breathing as well. Here's a couple of my favorite breathing exercises. The box breath I teach to all of my clients. It's super easy to do and super easy to remember. All you've got to remember, oh, sorry, I lost my microphone. We're back. All we need to remember is 4. So we breathe in for a count of 4. We hold our breath in for a count of 4. We breathe out for a count of 4. We hold our breath out for a count of 4, and then we repeat it 4 times. And I try to get people to do that at least 4 times a day, but obviously every hour would be better. The other one I like to do that's super easy to remember is breathing in for 4 and breathing out for 6. So this is a really good one. When our expiration is longer than our inspiration, it tends to be very relaxing. So remember, we don't want to be really breathing out for long breath exhalations or really blowing our breath out, because we've learnt that we don't want to reduce our carbon dioxide too much. But in for 4 and out for 6. So it's 10 seconds, 6 in a minute. If you're doing that, every hour would be fine, just a few of them, and that will help to get that breathing rate down. So remember, we're aiming for that 8 to 12 breaths per minute. And there's a download there that you can grab from the download section that's got a couple more breathing exercises on, and I'm often posting more breathing exercises on the Instagram page, so keep an eye on that as well. So there you have it. We've learned all the things you need to do to get that set point back to normal to improve our breathing pattern. And the big benefit of that will be keeping our brains beautiful and oxygenated, and therefore reducing those migraine attacks and the severity of them when they do come. So make sure, if you haven't already, download the breathing assessment. Make sure you do that, and download the worksheet to give you some ideas. A lot of people find they have really good intentions and they want to do it every hour, but the day gets in the way. So I often recommend either setting a timer on your phone or downloading one of the apps. There's heaps of breathing apps. Even on the Apple Watch, you can get a face where, it sort of goes up and down with the rate of the breathing. So there's so many resources out there that can help you reset your breath rate. So next up, we're on to our bonus section, and we're going to start with routines and rituals. See you then.